China and the World Health Organization are at loggerheads after the UN body questioned the sustainability of Beijing's zero-COVID strategy. The WHO is now being censored on China's two largest social media platforms. Meanwhile, officials are imposing further restrictions on the city of Shanghai, where there have been rising infections. Food deliveries aren't allowed, and access to hospitals for all but emergencies must first be approved. Ashley Atbas reports.
Since the coronavirus outbreak started back in 2019, China has pursued a zero-tolerance approach to the virus. The policy has brought several huge cities to a standstill and left millions of people stuck in their homes for weeks at a time. But the World Health Organization says Beijing's approach is no longer viable.
When we talk about the zero COVID strategy, we don't think that it's sustainable, considering the behavior of the virus now and what we anticipate in the future. And especially when we have now a good knowledge, understanding of the virus, and when we have good tools to use, transiting into another strategy will be very important.
Beijing reacted to WHO chief's comments by squashing any online debate about their zero-COVID approach. Searches for the terms Tedros and WHO reportedly displayed no results. But the Chinese government is adamant that it's pursuing the correct strategy.
Chinese government's prevention and control policy can stand the test of history, and our prevention and control measures are scientific and effective. China is one of the most successful countries in epidemic prevention and control in the world.
The financial hub of Shanghai is now in its 7th week of its citywide restrictions. Officials will, over the next few days, further restrict access to food and hospitals in some parts of the city. Neighbors of people diagnosed with COVID-19 are also reportedly being forced into government quarantine facilities. On Wednesday, China reported a total of 1,905 new cases.
All entities and individuals in the territory of the People's Republic of China have the obligation to comply with preventive and control measures, such as logical investigations, testing, sampling, quarantine and treatment of infectious diseases adopted by disease prevention and control institutions and medical institutions.
Health authorities in China say abandoning their zero-COVID policy could result in more than 1.6 million additional COVID-19 deaths. Aslat Bash, TRT World.
Well, I can speak to Dr. Bharat Pankhania now. He joins me live from Bath in the UK. He's a senior clinical lecturer at University of Exeter Medical School. Good to have you with us. So lockdown is a very familiar concept, but China seems to have taken it to a whole new level. Do you think a zero COVID policy is sustainable?
No, in very short measures, answer no. And I totally agree with the WHO's position, which is now that we have better quality vaccines, we've got antivirals and we've got medication, as a human thing to do would be to go easy on the draconian, the very, very, very strict lockdown measures that China is exercising. I would advise China that, of course, you've done well. You know how to do infection control and prevention, and you did very well. But now that we know how the virus behaves and we've got good vaccines, why don't you immunize your population with the better platform of vaccines and also have your antivirals at the ready? It will help you, it will help your nation.
Yeah, this is the interesting thing, that only half of China's over 80s has been vaccinated. Why isn't its vaccination program more widespread, which would mean that the risk of 1.5 million people contracting the virus would be diminished?
So it is an issue of confidence and faith in the vaccines being used in China. And we know, and it is better to be honest and transparent, that the Pfizer, Moderna, AstraZeneca platform of vaccines have been more effective and are, shall we say, better. And it would be a straightforward issue to say, look, let us buy the Pfizer, Moderna, AstraZeneca vaccines and deploy them. And the world at large has more confidence in those vaccines as well. So there is a lot of vaccine hesitancy in China as well, especially amongst the vulnerable groups. And therefore, when the virus starts circulating in China, there is a lot of panic about now what to do. And then you have the draconian lockdown measures. A better way forward would be to immunize with a more effective platform of vaccines.
Dr. Pankania, thank you very much indeed for joining us.
Thank you.